Hello, everyone. Welcome to the Image and Wire Show. My name is Jake Fishman. I'm the host of the show and the editor of the Image and Wire newsletter. And we have a great episode for you all today. We have Mark Koeniguer from ScreenPoint Medical. Mark is the CEO there, and he also has a really deep history in imaging and in breast imaging and in AI. And those are things we're going to talk about today. Mark, welcome to the show.
Thank you, Jake. Appreciate the opportunity to be here. Also, the opportunity to really highlight the great work by the ScreenPoint team. So looking forward to the conversation.
I'm looking forward to it too. And it's great to have you on. It's great to see you again. This is the kind of second times we've crossed paths. For the folks who maybe haven't crossed paths with you before, maybe you can give us a quick intro to yourself and your background, and then we'll segue over to intro to ScreenPoint.
Yeah, thank you very much. So I started my career at GE Healthcare. Spent 14 years there, holding leadership positions in finance, sales, and marketing. Left GE in 2001, and I've done multiple startups. And 3 of those have been in women's healthcare. The first one was R2 Technologies. They were first to market CAD, Jake, in the early 2000s. We really grew that company tremendously. We helped bring reimbursement to CAD, and eventually that company was acquired by Hologic, and they're the women's largest healthcare company in the world. Subsequently, recently, I was part of Alpara Health, the world's leading breast analytics company. And we grew that from very nascent revenues and nascent presence in the global market to, a leader in breast analytics. And we took that company public on the Australian exchange. That's where I met the, great team at ScreenPoint. We actually developed a partnership there and got to know the team extremely well. And eventually that led to my current role as the CEO at ScreenPoint Medical.
That's quite a background, and it's great that you ended up at ScreenPoint. Seems like they're doing great stuff. Can you give me a little bit of better understanding of ScreenPoint and Transpara and what they're doing?
Absolutely, Jake. So thank you. ScreenPoint Medical was founded in 2014. It was a spin out of Radboud University in Nijmegen, the Netherlands. And what happened was, so one of the founders, Sir Mike Brady, was working in robotic imaging. And unfortunately, he had a personal experience where his mother-in-law passed away from breast cancer. And it really got him thinking about how can I combine what I'm currently doing in robotic imaging analysis and really make a shift into, breast AI space to solve a growing problem around the world. And then he met Nico Karsemeyer, another co-founder of the company, and they founded ScreenPoint Medical. So again, a lot of times, either through personal experiences, you hear this all the time, and it's also true of ScreenPoint Medical. That's how we got our start. And so there's a big scientific push behind the company, and that's how we got our start with Sir Mike Brady as well as Nico Karsemeyer, and we kind of grew from there. And the whole mission of the company has been, how do we, solve the problem of late stage cancer detection by developing software that helps us with early cancer detection? And that's our mission. And we want to do that in a very robust enterprise fashion as we look at our roadmap. We want to do that with 2D and 3D mammography, but we also want to do it with ultrasound and breast MRI. We want to create a suite of products that are focused on women around the world. The Transpara product in particular, is neat because this was developed. We do a couple of things. We create a scoring system for every study on a scale of 1 to 10. And it's not a linear score by any means, it's exponential score. So anything in this score 1 to 7 has a high negative predictive value for no cancer, and everything from 7, 8, and 9 has a high positive predictive value for cancer. So that can be used, in different reading environments around the world. So where you're doing double read in Europe or single read in the US, et cetera, they can use our software in different ways. Why? We're FDA cleared for concurrent reading. So they get to choose the best way to leverage our software for early, cancer detection and prediction.
I didn't actually know about the your plans around MRI and breast ultrasound, but that makes a lot of sense, and they all kind of belong together.
Indeed. So that's where we're going. And then part of my purview as the new CEO I mean, again, to move the company from a scientific standpoint into the commercial standpoint. And so part of the power is that I've done this with other companies. And I want to take this enterprise-wide approach, expand upon that within our roadmap. And even though we operate in 30 countries today, we're going to continue to grow and grow around centers around the world. And I've done it before for multiple companies, and I look forward to leveraging and building partnerships with other OEMs, PACS companies, other imaging providers. There's the platform plays, which are really starting to make great inroads in certain markets. And we sit on a number of platforms as well. So the combination of direct sales plus OEM partners and key strategic platform sales will help us drive this enterprise approach into the marketplace.
When you're talking to a radiologist or breast imager for the first time about ScreenPoint and Transpara, what are the types of things that they ask?
Well, I think number one, if you look at AI in general and a lot of the claims, there's been 150 different AI companies introduced to the market in the last 7 years. One of the first things I ask is, what are your proof points? Do you have clinical evidence, to support your claims in the marketplace? And we really do. I mean, if you look at our products overall, fundamentally, if you look at two largest studies of its kind, one out of Norway, 122,000 women. So 86% of those screen detected cancers and 45% of the interval cancers were given the highest Transpara AI score available. So that's a very high positive predictive value for cancer. And I think on the heels of that, we've got the Denmark study. And the Denmark study, is also, it's 114,000 women. And of those women, essentially showed equivalency for detection rates, while also showing a 25% reduction in false positives and a 62% improvement in workflow productivity. So the combination of things is what we really try to hit on, is the overall detection accuracy, the improvement in workflow, the improvement in false positive rates, across the board. So we have a lot to demonstrate, all backed by clinical science.
I actually remember covering those two studies, so kudos on those. And I would say that, as a person who's covering the industry, one of the things that I see that's different about ScreenPoint is just the mounting pile of evidence, of scientific evidence backing your product. What are the other things that make Transpara different?
Yeah, I think if you look at the things that make Transpara different is, we're based in science. I mentioned clinical science, but at the same time, we are the only, AI solution that is FDA cleared for all the major OEM products that are also FDA cleared. So GE, Fuji, Siemens, Hologic. We're the only ones that have all those clearances, so we can play across the board. And again, that really helps, demonstrate the power of the science behind us and the team we have working with us to create those integrations and those workflow improvements.
Say for the radiologist, we talk about the different things you just mentioned. So the integration, but then also the efficiency and the accuracy that comes from it. Are there certain components of that specifically help radiologists?
Of course. I mean, if you look at the early days of CAD, I think that was what was missing. We're talking the early 2000s, shifting back for a second, is that, the CAD was there, but the reading environment wasn't there. It was playing on different platforms. So today, if you look at the important things, it's the clinical evidence, it's the reduction in false positives that benefit the patients. It's the increase in accuracy, and it's the overall just, improvement in workflow and creating that patient journey and the benefit for the patient to really end the late stage cancer detection.
Maybe we can dive a little bit deep into that benefit to the patient part. So,
of course. Yeah, the patient benefits, I mean, again, first and foremost, that's where we want to focus in healthcare. What solutions do we bring to the market that benefit the patients? And number one, increase detection rates. Two, reduce false positives. That means a quicker read on the part of the radiologist so they can get those results back to the patient to reduce anxiety. There's less follow-up, and they get the right diagnosis the first time through. So it's just that whole patient, reduction in anxiety. So if they come to they're coming to the clinic once, they can get the diagnosis once and move on with their lives.
You mentioned CAD earlier, and obviously breast imagers have a deeper history with AI or computer assisted detection and diagnosis than other parts of radiology. so, they have those initial questions we talked about earlier. After they've, been able to experience Transpara, what are some of their reactions?
Well, fundamentally, the reaction has been extremely positive. I think that, today, the environment today is you've got a two-headed monster, right? You have breast cancer rates increasing. Okay. At the same time, you have the radiologist shortage. So if you look at the radiologists, like, I need help. What kind of tools exist in the marketplace, that can help me get through this workload? Coupling those two things with the third one is the exponential increase in the number of images they have to look at. The move from 2D to 3D is not insignificant. Let's take a center that does 5,000 cases. Okay. In a normal 2D environment, 4 views, that's 20,000 images they're looking through. Okay. If you move that to 3D, that's normally that's going to increase to 500,000 images they have to look through on an annual basis. So the exponential growth in the number of images, given the same case volume, just by moving to a different technology, is critical. They need tools to help them. So you got a radiologist shortage. You have increasing cancer around the world. So when they implement our program that fits right into their workflow, as I just mentioned, we are the only vendor in the marketplace today that is fully integrated with all the major OEM players. It creates an environment where all of a sudden, like, it's that aha moment. It's like, wait a minute, I don't want to go into another reading environment where I'm not using Transpara and an AI tool to help me on a day-to-day basis to get through the workload. It's helping my increased cancer detection rates. It's reduced my false positives, and that really benefits the patient overall.
You mentioned earlier, and this is actually really neat, that this is your third breast imaging company that you've been with, and you got your start in the almost 20 years ago, which is amazing, a lifetime in this space. What are where do you see breast AI in terms of its evolution, and what do you see as the main trends that are driving that evolution forward?
Right. Well, if you step back from that, AI, in all aspects of our lives, okay, is something that we can feel and see every day. We may not see it, but it's there. It's in our phones, it's in our cars, and certainly it's becoming more prevalent in healthcare, all aspects of healthcare, and all types of disease states, whether you're talking about something with the lungs, stroke detection, et cetera. AI is in existence. So I think we're still in the early innings when it comes to AI evolution. There's a lot more to be developed, but the data sets and the deep learning algorithms being used today versus when I got started have grown tremendously. A lot of clinical research around the world, diverse populations, diverse data sets. And so the tools have gotten better, and the algorithms have gotten better, and the approach is better. And it's all being trained on better and better data sets due to this fantastic research around the world. Again, that's benefited Transpara and our science, working with Radboud University out of Nijmegen, the Netherlands. We've got a great team of researchers and scientists working with us. And again, this collaboration with both the industry as well as the healthcare industry is coming together to create better tools. Two, when I first started, there was always this argument, I don't need this, I don't trust it, it's going to take over my job. We're not here to take over radiologist positions. We're here to help support what they do every day. And you could take that analogy I mentioned about Tesla cars, for example. You still have to drive the car, but there's a lot of AI technology built into the car. At the end of the day, the radiologists have to make the final, diagnosis for the patient. But why not use tools to help them get through the, increasing burden and the workload on a day-to-day basis, especially when the clinical evidence justifies and demonstrates almost equivalency in terms of reading, while at the same time adding to their, making their productivity much better. So these trends in AI will only get better and stronger, and I think it's going to continue to add to the benefit of radiologists and patients around the world.
So if you take those trends and we push them forward X years into the future, what are we looking at in terms of the role of AI in healthcare?
I think the role of AI in healthcare is one of what I would say first and foremost is just, let's start with trust. I think there has to be a level of trust that the AI and the great work that's being done by Transpara, ScreenPoint Medical, and other companies. Okay, at some point in time, it reaches that inflection point where the software is just there and people understand how it works. It's not the black box theory. Okay, it's there to help make their jobs better. And I think if you do that, it's going to be built in a lot of different aspects of imaging across the board. And I think when that level of trust is there, we have these software tools that will help the radiologists get through their workload and also make better diagnosis and even predicting diagnosis, getting into risk. What is the risk by patient of developing breast cancer, for example? So we're going from detection to prediction to diagnosis to risk analysis. So I think that evolution is gonna make a huge change. Two, we'll also see additional tools being brought in. Today, we're talking primarily 2D and 3D mammography or X-ray, but as that risk profile is built, okay, and that person is triaged to ultrasound, we'll need AI tools for ultrasound, okay, that meet the demands of the market. And also, if they're triaged to their high risk, let's say they're a candidate for breast MRI, again, those are good candidates to develop AI tools around breast MRI. So at the end of the day, we are focused on developing an enterprise suite of products that benefit not only clinicians, but patients for early detection, prediction, and diagnosis.
That makes a lot of sense. And it's a really interesting future to think about, particularly given, how much focus, but also how many more steps, like you said, the early innings, right?
Right.
So we've covered a lot of ground already. For the folks who are watching, who are taking notes feverishly, but want the big picture, what they should really take away from this. What are the main takeaways? What are the main lessons from what you're seeing, what we've talked about that are really important to understand as far as breast AI and ScreenPoint and Transpara?
Well, again, unfortunately, if you look at the marketplace for a moment, we see that cancer detection rates are increasing worldwide. As I mentioned, there's a radiologist shortage. We see a shift in moving from 2D to 3D and what that means to overall workload. We see that AI is certainly growing in the marketplace, but a lot of the companies don't have the clinical evidence to back up their claims. If you look at ScreenPoint Medical, I think we hit on all those points. I think we have 15 peer-reviewed papers that support our technology. It's probably more than any other vendor. In fact, it's probably more than all the other vendors combined. We're the worldwide leader, and we operate in 30 countries. So we're seeing the benefit, being realized in many countries around the world, which is to the benefit of the patient and clinicians. So this is growing. But as I mentioned before, we're still in the early days. But nevertheless, we are seeing success across the board. We're gonna cross over the 3 million study mark here this month in terms of number of images analyzed or studies analyzed with our software, and we're starting to grow exponentially. And with operating in 30 countries, we're starting to hit big centers around the world. We're the only one being utilized, for example, in a major screening program out of Denmark. Prospectively, our Transpara score is being used. So the negative predictive value of the score of 1 through 7, for example, is being utilized in place of a second reader. So all that sums up in terms of we see better detection rates, better productivity being used by large screening programs, okay? And we can get into risk profiles for women. So at the end of the day, by working with clinicians around the world, we're going to see improvement in detection, prediction. At the same time, we're going to help radiologists get through their workload and take on this, this two-headed monster that is really the increasing cancer detection rates, if you will, and the lack of radiologists around the world to get through the workload.
Right. Those are some big problems and big opportunities to target. So that's really neat. And what I would say to the folks watching, if you have a stake in breast imaging in your practice or within your organization, and you're interested in better productivity within this part of your workflow, and you're interested in better diagnostic accuracy and detection within your workflow, check ScreenPoint out. Give Mark a call. Reach out to any of the Transpara team within your region and check it out. And Mark, thank you for joining and sharing all this. This is you've been busy, so kudos on all that.
Thank you, Jake. Appreciate the opportunity. It's always a pleasure.